Okay, so welcome back to the Men's Health Hub. Today we're going to tackle a topic that isn't discussed enough. It's called delayed ejaculation. Now, if you or someone you know is struggling to achieve ejaculation despite adequate arousal or stimulation, this is the episode for you. We're going to cover what it is, what causes it, and how to manage it with conventional treatments and natural remedies and practical strategies. So let's get started. So this really is a condition that is the inability to reach ejaculation during sexual activity despite normal arousal and normal stimulation. Some men may only be able to achieve it through masturbation, and for others even that can be challenging. Now, this condition can cause frustration, anxiety, strain in relationships, which is why it's so important to address this head on. So let's talk about what some of the causes are. So whenever you have DE, it can result from a mix of physical, psychological, and lifestyle factors. First of all, on the physical causes, there can be nerve damage caused by conditions like diabetes or spinal cord injuries. There can be medications, particularly antidepressants, SSRIs, antipsychotics, and blood pressure medications. There can be hormonal imbalances, especially if it's low testosterone, and there are chronic illnesses such as multiple sclerosis and prostate problems that can cause an impact. When it comes to psychological then, there can be anxiety and performance pressure. There can be depression and unresolved emotional trauma, and there can be relationship issues, including the lack of intimacy or communication barriers. There are lifestyle factors, so excessive alcohol consumption is associated with delayed ejaculation, and fatigue or physical exhaustion can also be a factor. There can be an over-reliance on types of stimulations such as frequent pornography use as well. Now, it's important that you understand it's a combination of factors rather than one that's causing this, and it's understanding what your specific triggers are is important for treatment. Now, when it comes to conventional treatments for delayed ejaculation, you will be offered things like changing the dose or the frequency of medications, particularly if it's an SSRI or blood pressure drugs. You might be offered hormone therapies to boost the amount of testosterone in your system and to improve sexual function. Psychotherapy and counseling with CBT can help address anxiety and depression and performance-related concerns. And couples therapy can help improve communication and resolve intimacy issues. There are also things such as medical devices that will help stimulate and trigger the ejaculation in men with nerve damage. Now, when it comes to functional and natural approaches beyond conventional treatments, there are some herbs that can help make a real difference here. First and foremost is a herb called ashwagandha. Now, this is an adaptogenic herb and it helps to reduce stress. It helps to balance testosterone in the system and improve sexual function. In research, ashwagandha supplementation significantly improved testosterone levels and reduced cortisol, the stress hormone, in men experiencing stress-related symptoms. Another study highlighted that it had a role in improving sperm quality and sexual health by enhancing testosterone and antioxidant levels. Its adaptogenic properties make it particularly effective in addressing stress-induced delayed ejaculation. Catuaba bark is a Brazilian medicine, and it's a herb that improves nerve sensitivity and sexual function, so particularly of interest here for delayed ejaculation, for its aphrodisiac properties and also for sensation. Next up is a herb called ginseng. This is also an adaptogen used in stress states, and it's well researched that it's a herb that boosts stamina and enhances overall sexual performance. Clinical trials had shown that Korean red ginseng significantly improved erectile function and overall sexual satisfaction in men with erectile dysfunction. Another study in the American Journal of Chinese Medicine highlighted ginseng's ability to enhance nitric oxide production. So that improves blood flow and stamina, and it encourages you to hold the strength of the penis and the erection for a little bit longer. Now, next up is a herb called Mucuna pruriens. It's a natural source of L-dopa, which supports dopamine production and improves nerve signaling and the ejaculatory response. In 2014, it was demonstrated that mecunopurians significantly increases dopamine levels, which are essential for proper nerve signaling and the ejaculatory function. Another study in 2011 highlighted the role of improving sperm motility and testosterone levels, making it really beneficial for overall sexual health. Ginkgo biloba is known to improve blood flow and support nerve repair, especially in cases of circulatory issues. So if diabetes is part of this, or you have had damage to the nerve tissue, ginkgo biloba might be helpful at improving peripheral circulation and nerve sensitivity, aiding in sexual function. Tribulus terrestrius is known for boosting testosterone and improving libido. It has shown efficacy in addressing sexual dysfunction and may be of use to improve satisfaction and function in men. Horny goatweed then. This contains a really interesting constituent called icarin, which enhances nitric oxide levels, improving blood flow to the penis and supporting erectile health, including ejaculatory concerns. Next up then is Tunera diffusa. It's traditionally used as an aphrodisiac. Now, it's also helpful for mood. So if you are on an SSRI and you want to come off it, you might consider Tunera diffusa as an NOAI. And it helps reduce performance anxiety and enhance sexual arousal. I tend to think of this as a herb that gives you body confidence, that you kind of can say, ta-da, I have arrived. And it suggests that it stimulates the nervous system and helps support sexual performance. There's a mineral-rich substance called shilajit, and it enhances testosterone levels and energy. It is demonstrated as beneficial for male productive health. Safed musi is often used to help treat male infertility. It enhances libido and reproductive health. And then yohimbe contains a constituent called yohimbine, which improves blood flow and nerve sensitivity. Now, yohimbe significantly improves sexual performance in men, and it has particular merit in psychogenic erectile dysfunction and would be used in a way similar to that of Viagra. It does, however, have some contraindications and does need to be used cautiously due to the side effects such as increased heart rate and anxiety that are associated with it. So it's not a first protocol, but it is something that can be useful. Zinc-rich foods like pumpkin seeds and shellfish are supportive of testosterone levels. Magnesium foods like spinach, nuts, avocados help improve muscle and nerve function. And omega fatty acids from fish are helpful for inflammation and promote circulation. Stress management is a major contributor for delayed ejaculation, so practicing meditation, deep breathing can help reduce anxiety and promote relaxation. Reducing alcohol, which depresses the nervous system, is certainly something you want to consider. And prioritizing sleep to restore your energy and optimize testosterone production is worthwhile. So what practical steps can you do to manage delayed ejaculation? Try talking about it. Everybody will probably say, well, they're jealous because it means you have the perfect opportunity to maintain an erection and please a woman. But an open, honest communication with your partner and with your friends to help reduce the tension you have and to feel supported is definitely one way forward. Try new techniques. Experiment with different positions. There's some positions where you can get the vaginal wall to be tighter in and around the penis for greater sensation and to stimulate, whether it is, a ring that's vibrating on the penis to try and encourage what works best for you. Focus on mindfulness. So stay present during intimacy instead of focusing on the outcome. And that can really help reduce performance anxiety, and seek professional help if you need to cover physical and emotional factors that are key. So do drop me a line, send me an email if you want to talk about it further. And it's certainly something that we should be able to manage. Thanks for joining us and see you in the next one.